Hello, my name is Zachary Pinkley. I'm an undergraduate research assistant in the Northwest Tissue Mechanics Laboratory. Biomechanical testing can provide insight into how our bodies handle forces and experience wear. The human knee joint is highly prevalent in clinical research due to the large number of injuries sustained to the knee and its soft tissue structures like the meniscus. However, improper alignment of the knee during biomechanical testing can cause higher than natural forces and kinematic errors, resulting in specimen damage. These problems are further increased during disarticulated knee testing, where existing soft tissue restraints are removed and can no longer provide support for the joint. Therefore, the objective of this study is to define and quantify a method to repeatedly position disarticulated knees to their natural intact alignment or in situ position. For this study, a cortical foam replica of a human knee was used to address the study objective. Anatomical landmarks of the tibia and femur were marked with screws and digitized to embed joint coordinate systems using the Grud-Sunze convention. This allowed the in situ position to be quantified using clinically significant rotations and translations. Kinematic markers were also attached to each bone to simplify the digitizing process. To imitate and record the in situ position, the tibia replica of the knee joint was secured in our testing apparatus in a hanging position prior to disarticulation. Once the in situ position had been digitized, the joint was removed and disarticulated before reinstalling it into the testing apparatus. Intermediate marker positions were then digitized and input into a custom MATLAB code, which provided us with the required adjustments to guide the joint back into place. Adjustments were then made incrementally using an XY table and sine plane until the joint was within plus minus 0.5 degrees for rotations and plus minus 1.0 millimeters for translations. Once the in situ position had been reestablished, the tibia was removed and reinserted into the testing apparatus, and kinematic markers were redigitized. The tibia removal insertion process was done 3 times for each trial, and in total, 3 trials were conducted of the entire protocol. Errors between the in situ and disarticulated joint positions did not significantly change after the repeated removal of the tibia from the testing system. This suggests that the in situ position was accurately reestablished for all time points in each trial. Average differences in rotations and translations were found to be 0.33 degrees and 0.50 millimeters respectively, and can be explained in part by the inherent error of using the digitizer. For the first time, this study provides a method to reestablish natural joint alignment accurately and repeatedly for disarticulated human knees using Grud-Sunze clinical rotations and translations. By improving joint alignment, this study can help advance clinically impactful research in knee biomechanics and total knee arthroplasty technology by ensuring significant force concentrations and kinematic errors are avoided.